of today's session. As I say, periodically I'll go into the participants and I'll just invite those others that we can't seem to get just now. So, reflective debrief. This is a little individual task that I'm asking for you guys to take on board at the moment. It's to try and embed the skills that we've been teaching you around about becoming this inquisitive, curious learner and trying to get you to understand gaps from your daily experiences, trying to make you think and focus a little bit about the practices that you witness, the kind of interventions that you're being involved in your placements. And this is from all placements, I know, because this year in particular we're all over the place. It's not just your placement 3 you're on. Some people have been in placement 1, some are in 3 just now, some have yet to do 3 but they've done 4. So we're just a little bit all over the place at the moment with placements. But on your placement experience today, what we're asking you to do is to try and learn a little bit more from your environment about the practices that you're seeing. Now, this could be due to interventions, it could be due to the population that you're working with, it could be due to the practice educators, their interests. Sometimes their interests are particularly focused on a certain school of thought that you maybe haven't, delved into at university, and that piques your interest. So it's just really about trying to capture things that you see and you witness in practice and how that stimulates your thoughts. So we want you to try and reflect upon this, not just because it identifies your own personal gaps and strengths, but also because it enables you to become a little bit more of a self-directed or active learner. It makes you think a little bit more about your own areas that you want to develop. And of course, it can be used as evidence of learning, and that can be captured in a simple document that's stuck in your e-portfolio in Turas, and then demonstrates your currency of thought and the kind of activities that you're undertaking. And sometimes when you look at people's portfolios for CPD, when it comes to the HCPC audit that happens, a lot of people will have, in services, a lot of people will have reflective accounts on maybe case studies that they've actually undertaken as practitioners. It's looking at research methodology and looking at literature review isn't necessarily something that's done as much as you would think in practice. So this is, you guys are getting this steer to become much more behaviourally, intuitively interested in research methods and trying to kind of put these methods into place as part of your CPD. So, little task to begin with today. I want you to reflect on your focus of your essay, identify the intervention at the top. So again, typical breakdown, you've got your what, so what now sections, top to bottom, top third, bullet point, what is your focus for your essay. Middle section is going to be a few bullet points bringing out these elements of why is this important. Why is it important for you to study the intervention? Link it to your clinical effectiveness, the safety aspect, possibly the elements round about. Even we've already this morning heard people's accounts of, well, I know that this is a really good treatment, but it's very pricey, it's resource intensive, it's got a lot of time attached to it as well. Sorry, there goes the dog. So these are the kind of elements that are really important to us when we're trying to say, well, why is this continued study on your intervention going to be really important? How is it assessed in practice, for instance? What outcome measures have been used in the literature? Are they actually replicated in the practice setting, or are the practice setting using very different outcomes that are actually related to the literature? So why will this review of literature support your practice and indeed the practice of physiotherapists? Your planning section is really identifying what gaps are still there with your understanding of the intervention or the treatment. It could be that the populations that you've witnessed are very niche, and possibly you want to explore how this treatment impacts a broader population or a different population. Or it could be that there's a comparative treatment that's available and you want to recognise, well, what's current practice? Indeed, is this population having physiotherapy input, or is this population possibly new to the physiotherapy world? So there's maybe not a comparative treatment to actually compare it against. And again, looking at the validity and the reliability, sensitivity of those outcomes that are used in practice. Are they actually doing what they say they're doing? Are they sensitive to detect change? Because remember, sensitivity to detect change allows us the confidence about the presentation of the client. Are they improving? Are they making grounds on where they were this time last week, last month, last year? And that shapes your decision making when it actually comes to the management of the client. So I will be looking for you to produce some examples on this. I'll give you till about quarter past, maybe just quite after, so about 5, 6 minutes on this. Just jot down those three sections: the what now, thinking about your own piece. We'll shut down. We'll see you in 5, 6 minutes, and I'll open the floor up to anybody else. Okay. Okay, guys. So I'm opening the floor up to you guys. You should have some form of what now, looking into your very skeleton reflection on the task that you were asked to do for this. And it's quite nice to do that just for 5 minutes reflection. It's a really nice technique of just trying to get a wee sense check yourself about the elements of your essay, about where you are, what elements do you need to maybe pull out a little bit more, or what areas are you really quite grounded and quite strong in, especially around about the action plan, around about the gaps that still remain with your interpretation and intervention. Would anyone like to go first? I don't know how you are for maybe providing an example just for something for us to kind of try and pick out. I'll wait, if you just put your hand up, we'll be able to see. Or I'll just drop a wee name in and you can come on. Okay, let's just randomly look at Abby McCallum. Hi Abby, how you doing?
Hello.
Your name just always just seems to appear, Abby. So, tell us just about your breakdown and how it's shaping out.
So my intervention is body weight supported treadmill training for stroke patients.
Okay.
And improving balance. So I think
Is this the GMAX, the gravity thing?
it was just on my stroke placement. They were doing they had like the hoist and they had the patient supported and they were doing treadmill walking.
Very good. Okay. That's interesting.
So I was just going to pick this one and see if it was improving balance, because I think the research is mainly on improving gait speed, and that's why it's recommended. So just chose this one to see about if it improves balance outcomes, and then is it better than just normal gait, like repetitive task training?
Okay, so you've got a couple of things in there, and I think we need to be quite tight about what your population is, about what the intervention. It seems to be you've got your intervention and also some kind of comparative management, but also what about the outcome? So what is it that's driving this research question? What is it you're wanting to achieve from your treatment? That drives the outcome. We spoke about this morning. It's not necessarily just about the outcome tool that you'll be using, but certainly the outcome domain. And then once you've chosen that outcome main, whether it's function, whether it's speed of walking, you can then look towards a measurement tool to actually demonstrate how you would achieve that and display that. What elements of that really triggered your thought?
I would say it was just, I looked at the research already and the guidelines said it recommends body weight supported treadmill training for improving gait speed, and I just thought it'd be useful to do a bit of research and the other outcomes within this. And then I had a wee look and found there was some articles on if it improves dynamic balance in stroke patients.
So now we're actually starting to see about where you've taken something that piqued your interest in practice. You've had a little think about that, but you've still got elements of that you want to find out just a little bit more on. So you're scratching the surface of that evidence base as to what you know, and you're starting to come out with more things that you want to go and research. And I think that was something that we wanted to pick up, and it's worthwhile just maybe saying it again for those people that certainly the students that we saw and we discussed this morning. In that personal reflection section, the guidance and the assessment it's picking out this a bit about a critical appraisal of research papers, and it's possibly a bit confusing because we don't want you to undertake a critical appraisal at that point in time. What that section really means is, based on your understanding and your critical appraisal in loose terms, it could be papers you've read, it could be what you've learned in class and been directed to as additional reading in class, it could even be a couple of papers that you've been directed to from your practice educators out in placement. So from that kind of very shallow dipping your toe in the water of evidence base, what's your general feel for the gaps, the strengths, what aspects have been researched well and what aspects have not been researched particularly well? And then you take that and you build your PICO round about that, And what you've done really quite nicely there is you've looked at the outcomes and you've thought, I want to look at the different kind of outcome domains that are actually being influenced by this fairly well established technique, because I think there might be other outcome gains and other outcome indicators that demonstrate a difference or a kind of strength of why you would use this particular intervention. So that comes out in your next section, in section 2, when you start to talk about the formulation of your research question proposal, how you went from your initial thoughts and your personal reflections and how you brought out the actual PICO elements of the paper. That was really nice. Thanks for that, especially when you're getting picked on to be the first to just come to the mic. Does that help you, Abby?
Yeah, definitely. Thank you.
Okay. Fred, do you want to say anything in that intervention, because it's up your street, is it not?
Yeah, I think it's a really interesting question, Abby. Very worthwhile. And I think it is a very valid question to think about. Yes, we're doing this primarily to improve gait, but what about balance? That's your first port of call really for safety. And it might be interesting because you'll probably find a lot of papers on the topic. What might be interesting is to think about whether you'd like to look at the evidence for people who are not able to walk independently at the start of the treatment, or whether you're interested in people who already can walk independently at the start of the treatment, because the outcomes are quite different for the two groups. So that's just, a suggestion. I'm not saying that you should do that, but I think, it's a really important topic area. Well done.
Thank you.
Are there any other particular examples that people want to share on this, or even just pop in the group chat if you're a fast typist, that is? Or maybe just pick another couple if nobody's saying too much. Neil, how are you this morning? Or this afternoon, I should say.
Not too bad.
Are you able to give us a wee idea as to what your focus is on your essay so far?
So I'm doing early mobilization in ICU, and yeah, so it was basically because I went into ICU and I was expecting everyone just to be sort of on life support and on ventilation, just lying in bed, not moving. But in reality, you go in and they're getting people up into chairs, there's people kind of using stand aids and stuff, and they're kind of making them sort of walk a little bit and stuff while on ventilation, and all this kind of stuff. And it just wasn't what I expected. So I kind of like was looking at and obviously like to get someone who is ventilated and is in really bad shape up and moving and kind of walking, or like sort of getting towards walking and stuff, it's obviously really uncomfortable for the patient. So I was like, right, there's got to be a lot of rationale behind this, otherwise they wouldn't do it. So it's kind of interesting. So I went and was having a look, and obviously there's a lot of evidence behind early mobilization and how it can sort of decrease your length of stay in ICU, decrease your sort of days on ventilation. It means like on discharge you will be more independent, and there's ICU acquired weakness is a big thing, and it kind of reduces this as well. So yeah, it's quite interesting.
That is really interesting. I suppose the part about this is about you finding what outcome you're going to choose and trying to be quite focused on what that end game is for why you're actually looking at this, because you're right, you've identified. It's quite interesting because the 2 or 3 outcome measures that you actually discussed there right at the start, I was thinking this is service-led provision, this is looking at resource management, this is because when you're looking at discharge planning and you're looking at beds, what's the length of stay of somebody in ICU, immediately I've got my kind of hospital service lead manager on thinking this has been done from a resource point of view about trying to kind of justify why certain people get that. Looking at the lived experience of the individual is possibly, something that you maybe want to look at from a kind of clinical perspective in there as well. But certainly the issues about, the strength issues that they have through being basically in ICU for so long, not weight bearing, all that element about how the cardiovascular system even is impacted by that. The metabolic rate, as we know, is significantly changed. So there's lots of stuff around about being immobile for that kind of length of time as well. Bone mass, there's been stuff on, the kind of osteopenic kind of patient post, almost similar to those astronauts that come down that have been in a kind of anti-gravity, environment for so long. So lots and lots to think about in there. But for the purpose of this, remember, keep it nice, neat, tight, so you're not being too vague and you're able to demonstrate that initial thought, how it's led into your research proposal, how it shaped your PICO, and how that PICO has come out in the quality appraisal synthesis that you've actually done. And then, of course, if you find a great solution and you've got lots of great papers on it, fantastic. If you don't find many papers on it, it's okay. And that's one of the lessons that's we're trying to get from you with this particular session, is that sometimes you set these PICO questions really quite tight and you don't get much back from it. All you can do is report back on that, what you find. So you can't make sweeping judgments, you can't make these leaps of faith, you can really only feedback on what you've actually found. But be prepared to be a little bit flexible on that. Fred, have you anything to say on that flexibility of the PICO? How do the students kind of find that kind of middle ground? It's quite a dark art, isn't it?
I think the term for it is iterative, is what you're saying. Is that you start off with a question and then you need to play around with it, and you read someone, you think, oh, I'm not really interested in this, but I am really interested in that. You adjust your question. And quite often you need to do that a few times until you're onto something that you think that's what it is. So just be prepared to be open-minded, adjust things until you find the papers that you really are interested in, and then make sure that everything is consistent. So, your reflection, your PICO question, and then what you extract from it.
Thanks. Dion.
Yeah, I just wanted to ask a question. I know you're talking about like if you might not find that many papers on a specific thing, and like if you didn't have papers that were all like focused on the same outcomes, would you be able to do that and then like justify it in the fact that there's not much like quality research on that specific like topic?
Well, without knowing what you found, it's difficult to know if you could or if you couldn't. I suppose the question here, and it's ringing bells for me about the outcomes that you're actually looking at. You possibly want to think about the outcome domains that you're looking at, and not necessarily outcome tools or measures that are actually being looked at, because it could be on a broad thing about the impact on pain, or the impact on range of motion, or flexibility, or strength gain, or function, or even quality of life. And there's so many different tools therein that actually do feedback on those particular areas of care and areas of outcome, I should say. So it's about not scrutinizing it right down to the outcome tool, but actually keeping that outcome in the O. So the O of PICO should be outcome domain, or the area that you're actually looking to feedback on, and not keeping it so narrow that you get very little. So you're still looking to gather papers that feedback and inform you of what that area of outcome has actually fed back to you. Is there any? Can you give us more of a steer on your question? We can maybe break that down a little bit more and give it some context.
Yeah, so I'm doing queuing and like how it affects like freezing of gait. So
Okay.
some of the like papers are like just on like gait parameters, but they've included like freezing of gait in an outcome measure. So like would I be able to use that as well, even if the paper's not specifically set out to look at freezing of gait, but has included it in?
Yeah, that is common, and we talk about maybe possibly that being a secondary outcome measure as opposed to a primary outcome measure. So it wasn't necessarily in their research question, but they did gather that level of data as a consequence of them undertaking the research. It can still be used. It still informs. It's possibly, if you were bereft of any other evidence in this field, but it fits your particular PICO question, then you can utilise that. But you have to guard your conclusions from that on the basis that that probably wasn't the overall outcome measure that they were originally going to look at. So that there might be flaws therein in that, but you can still use that as to add to the debate.
Yeah, okay, thank you.
Tim?
Hi, Doogie. I just have
Hi.
a question with regards to kind of the analysis portion for the reflection. I think you mentioned earlier that you were looking at kind of a very brief critical appraisal of, for example, I'm doing early mobilization as well, but in post-total hip replacement patients. So are you looking for kind of a brief critical appraisal in the analysis portion of the reflection, or are you kind of looking towards kind of the human or sociological factors as per what we normally do?
Yeah, I wish I'd changed that word now. You can tell that I'm trying to, go back. I wish I'd said a personal appraisal of the research papers that you had been exposed to, because I think that's what I mean. I don't mean you to undertake any more critical appraisal than what you already have got. So really, it's about when that trigger happens, when that critical incident happens, when you get this reflective moment of, I really want to find out more about this particular area. That analysis is about, on the basis of your own personal appraisal and personal reflections that you've got, you will probably already have read some stuff in grey text from university that we've directed you to as part of the module content. You may also have done a little bit of additional reading round about it as a prep before you go into your practice placement. Possibly your practice placement educator has given you 2 or 3 articles on that broad theme as well. So it's about what have you been exposed to at that point in time to give you that kind of reflective moment to understand the gaps and the strengths of the literature at that point in time. Obviously, after you've set your PICO, after you've set your search terms, your inclusion, your exclusion parameters, you then undertake this literature review approach where you start to go in to look at what the literature has to offer on that particular research question. But very low key, more personal appraisal within the reflection section, building up to more of a systematic review of the literature when you then have set all your search strategy and put that in place.
Right, okay. Yeah, so just to confirm is that we don't really have to look at kind of the human factors or like the psychological side of things, but more towards kind of your understanding of the pros and cons of the intervention per se.
Pros and cons, gaps and weaknesses, there may well be human elements and human factors to that. That might be one of the gaps. It might be that it's been done very kind of mechanistically, very through the biomedical model, looking at a kind of pre-post, this is what happened once we did this, whereas they maybe haven't looked at the qualitative type aspects of that. I'm not really needing you to go into the human factors at this side, because really we've been trying to steer you into quantitative type approaches. So really at this point, it might be something to mention as a gap. It could justify the reason why you want to know more because of your own understanding of the human factors, but we're certainly not wanting you to, at this point in time, go and explore different types of research and different approaches, because that's going to shape the outcome measure as well that you're looking for as well. Freddie, do you have anything to add to that? It's a good question, but I think it's probably taking on a bit more at this point in time.
Yes, I agree with what you're saying, Doogie. And I mean, you only have so much space, don't we? In the so it's probably to keep focused on the PICO question.
Yeah, and maybe what you're starting to do here, Tim, is you're starting to kind of get into the grounds of real critical appraisal of the literature gaps, and which we'd probably expect of an honours student in your honours project. You're kind of starting to get into that analysis and discussion section of your honours project, so just pull it back in again.
Okay, thank you.
Any other questions on that? Okay. We'll go into the next part of today's session, and it was just as a response to some of the questions that we were getting from students on this. How do we demonstrate the synthesis? You talk about the synthesis table. What does it look like? Well, we're going to try and give you an example. It's a student example. It's not perfect. It's good. There's some good elements in it. There's some little errors in there and some areas that you probably want to tighten up. But we'll break it down and give you an idea of, sometimes students just need a visualization as to what does the table look like, what the section's like, and we'll try and break that down in the next part. I think the main 3 points to think about when you're starting to look at synthesis of your quality of the quality of the literature is look at the quality appraisal tool that you're using. Now, you can actually, in some larger studies, look at different tools if you've got the time and the space, and you've got so many different styles of based on what your PICO question was. You might have a lot of kind of qualitative type approaches as well as quantitative, but for 3 quantitative essays, we're really just looking for the one single tool that you would look at applying the questions across all 3. Obviously, the questions that are asked in that quality appraisal tool are bringing out an understanding of the strengths and weakness, not just of each article, but actually across the range of articles that are researching that particular field. So it might be that there are significant commonalities with the research method strengths or the research method limitations that you're finding in this field or in this area, because possibly the researchers are all from the same pool, they're possibly all quite biased, that they're citing each other's work, but they're possibly all making the same methodological errors or limitations when it actually comes to breaking down their papers. So that's why you do this synthesis across the essay. Sorry, there goes the dog to the door again. So when you're scoring each paper, try to be very clear in your table what the response is per paper, and we'll show that in a wee second. And the last question to do is just pull together the elements of consensus or the elements of differences in the level of quality of the papers. So obviously we've only got 3 to look at. Consensus might be easier to do. Major differences will be hard because it's actually maybe just going to be 1 or 2 papers have got, a difference in approach in the way in which to do things. But you will need to try and look at the scrutiny of the quality of each paper first and foremost, and then look at it across all 3. So what do I mean by that? Hopefully this gives you some kind of idea. We've got a table with author, year of publication. Now for the purposes of the 3 papers, this would be Ref 1, Ref 2, Ref 3. Then you've got your CASP, for those of you who know the CASP tool, the questions that are related to the scrutiny of that paper. And you just clearly create a matrix of yes, no's, or yes, no's, maybes, can't tells. And this allows you to see quite clearly the strength of one paper looking across, but also in comparison to the other papers that you've found in this area. You might get 3 papers that are yes, 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 all over the place. That gives you a good confidence that there's good methodological approaches being undertaken amongst all the papers that you've found. When you start to see no's, there's a no there, there's a can't tell, there's another couple of no's down here, then that starts to give you a feeling that there's maybe not the kind of same consensus across all papers, that they're all doing the same things really well. Some elements of that methodological process might be greater or better done than others. And we'll just kind of take you through 2 or 3 examples. Straight away, the first couple of questions, and this is all to do with relevance, isn't it? Has the paper that you found relevant to your own research question? And here we have yes, yes, yes. Was it an RCT? And in this case, because we're looking particularly at the quantitative studies, and the RCT would be considered the kind of higher level of study, cohort-based study, we'll get yes, yes, yes. So straight away, there's a consensus that these papers are actually giving you a good sound structure of evidence base because of the approaches that they've taken. But let's look a little bit closer to part 4. Were the participants, the staff, blinded to the study groups? In the first paper, we do have it, but we can't tell in paper 2 and we can't tell in paper 3. It's not that it's not there, but they certainly haven't mentioned it, so we can't say with any assurance that that blinding has actually occurred. Now, that might be because of the intervention. That might be because of the nature of the control group, that it's difficult to blind those people that are involved. But what we're saying at this stage is, from the methodological process that you understand of these papers, are they demonstrating that this has happened? Because that gives you more confidence in the approach that they've actually taken. Now, we'll look at the 5, where the participants are counted. And this is telling us about who has been involved and where they all taken right to the end of the part of the right to the end of the process, because we know that not all researchers actually demonstrate the data that they've taken from all participants, and that's usually based on if there's been skewed participant data, there's maybe been reasons, but really we want to see that data for completeness, to demonstrate that there is a transparency to the way in which the data has not only been collected, but also to the way in which it's been reported upon as well. So that helps us get confidence in the value of the research findings that we're looking at. I'm just going to take you to a couple of sections, question 8 and question 9 here, because I think these are quite important to look at. And this is not just about the quality synthesis, but it starts to pull out the elements of the research base that we've got round about this, how well they go about their business. Here we have 19 participants included, and that was deemed not enough to minimise the play of chance. So whatever your findings were happened by chance and not through the actual intervention that was being studied. Here we've actually got, yes, we've got the study has got enough participants. It's actually only one participant more than the previous trial. So why are these yes and no? Well, a lot of things could create a sense of understanding that things are not going to happen by chance, but clearly here there has been a power calculation considered prior to the actual undertaking of the research. These researchers know that they need a cohort size of 20 to give them a fighting chance that they have got enough subject data coming into the trial so that they can, once they've done their statistical tests, it allows them to demonstrate that the effect has happened not through chance, but has actually happened truly in real life. And of course, it's a reflection on the larger population. And you can see here, oops, sorry, shouldn't do that, but you can see here in this last trial, yes, the power calculation was undertaken. It actually demonstrated 100 needed to be included. That's a very big number for most kind of healthcare trials, and certainly in rehabilitation. But that actually starts to kind of let you realise that the more numbers that are coming in, more likelihood that you're going to demonstrate some kind of normal distribution of the data, but also that the statistical significance has got a fighting chance of actually determining significance between the two groups. Now, when we start to look at how were the treatment effects recognised, here we've got no significant effect in the primary outcome measure, and you start to critique that and think, oh well, they didn't find anything. But actually, it might have been because they didn't actually look at the actual cohort size that they needed to. They might have been approaching significance, but had they got, say, 25 or 30 participants, this primary outcome insignificance, or what was deemed not significantly different, might have actually started to come about. So we don't really know, and you would need a deeper dive into the literature, into the particular paper, to actually understand what other influencing factors were there. But you can start to see that here we've got statistically significant improvements, albeit of small effect size, but you're starting to understand a little bit more how the actual size of a cohort can impact this ability to actually demonstrate change between groups. Now, in small cohort trials, and to be honest, a lot of physiotherapy research is based in smaller cohort trials. You sometimes have to really kind of scrutinise the measures of outcome, the levels of clinical of statistical significance that the researchers are trying to look for. And in this instance, we typically go for a 95% confidence interval with an alpha number set at less than or equal to 0.05 is the one that we typically look at, meaning that there's a likelihood that if the statistical difference between the both groups has been demonstrated to a p-value of less than 0.05, there is a 95% chance that that is happening out of an effect of the intervention and not as just by chance or randomly happened due to another artifact or another variable. That's not to say that there couldn't be another variable that hasn't actually been looked at, and that's when you have to understand your population, understand the natural flow of a disease and the way in which it plays out and it manages. We see this quite a lot of longitudinal studies, especially when there is a natural recovery to a lot of people, and we sometimes misappropriate the change to actually just the time frame in which something is actually improved over a period of time. And that's where you have to have an understanding of control groups. You have to have an understanding of, well, okay, I've done this intervention in this cohort, but actually I've also seen that the same impact was seen in somebody that never had any treatment. And that's possibly due to the resolution over a course of period of time. So you're starting to unpick through a synthesis table the meaning of the findings that you're starting to see in the trials that you've actually witnessed. I hope that's a nice little kind of taking you through synthesis, taking you through the table, giving you a visual representation of how you can use the table, not just to lay out the strengths and weaknesses. Some people use ticks and crosses, some people use colour codes like greens and reds. Regardless of the mechanism that you use, this is a nice basis to start to get you thinking about the consensus and the areas of disagreement that might actually be in the literature. Any questions on synthesis and tables at this point? Tim?
Yeah, I just have a question regarding the synthesis table as mentioned. So is it required that we compile all the studies into one synthesis table? Say, for example, because the search strategy that I had gave me results of 2 cohort studies and 1 RCT. So I know from CAS that they have kind of different forms. So would I have to put it into one table, or can I do it in 2 separate tables?
They are slightly different for that, you know, that is a difficulty just because of the nature of their findings. Obviously, the results, the actual questions aren't too dissimilar, though, are they? Are they very, very different? Try to remember. Do you remember?
And there are some, maybe I'd say two or three points that are slightly different, but more or less they are quite similar.
It might be that you have to actually demonstrate this in 2 tables and actually just look at the commonalities across both tables. So there's almost like a synthesis of synthesis tables that you're having to do there. It sounds a lot, but actually it won't be. Once you've actually got them demonstrated in this format, it'll be quite clear to pick out the commonalities that they've done well and possibly the gaps that they're missing. And again, this is to give you a sense of the level of quality that's actually out there in this particular field. And if these are just the 3 studies that you've found, based on the 3 studies that you've found, what is your initial critical appraisal actually telling you? So it's a difficult question. What's your take on that, Fred? Synthesis of synthesis.
Yes, I think what you suggest is probably the better approach, so that you use a table for each type of study. That probably stays more faithful to the quality assessment tools, because what you want to do is replicate the questions in the row here at the top. And so you'd have a different synthesis table. And I think it's fine. You can only synthesize it to a point, really, isn't it? But, you know, focus on the main things. But tabulating the studies in their own bespoke table is the best way forward. You might also like to think, you know, sometimes you do a mixed method review. So you might have qualitative studies and quantitative studies, and clearly you want those in different tables with their appropriate tools. So in principle, you've got the right idea about this.
It's a really hard, thanks, Fred. It's a really hard one, Tim, because, you know, part of this isn't about getting the right answer at the end. Part of this is about undertaking the right process. I mean, it might have been simpler if you'd found another RCT or another cohort study, just to be able to allow you that process and keep it nice and tight all the way through the same table. But I admire the fact that you're bringing in different types of papers, because that's what you found. And it would be daft to undertake this process and not include an RCT if indeed there's an RCT there. So, you know, I think you have to recognise the value of that RCT to the overall PICO question that you've set, and actually you'd be dismissing the value of the RCT if you didn't include it.
Yeah, I was just thinking along the lines that because my population and intervention of interest, it might be difficult to do a randomized controlled trial as compared to a randomized cohort study. So
without a doubt, and when we set PICOs, and we do this even now, you know, when we set up a new, you know, area of research, and the way you style your PICO will influence the kind of response that you get back when you do a literature review, because the questions that you ask are likely to go into a particular field of research with a certain research type and methodological approach, just because of what you're actually looking at, especially when you start to look at lived experience and the kind of outcome domain round about, you know, quality of life. That immediately changes the kind of methodological approaches that are going to be there and you know, to do RCTs looking at quality of life is really quite difficult unless you've got a really, you know, fantastic QOL tool, SF36 or something that can be distributed across vast populations, vast number of people. It's difficult. It's more difficult to do. Any other questions on synthesis and tables and visualizing, you know, how you're trying to pull this together? Fred, sorry, you've still got your hand up. I didn't know if you wanted to say anything.
No, sorry, it was just a word that Timothy used, if I've picked it up correctly. But did you say randomized cohort study? Did I hear that correctly, Timothy?
yeah, it was a randomized. They termed it randomized prospective study, but their methods were kind of using the cohort study methods. But they randomized their samples into groups. But it was a study. So my question of interest, maybe this would facilitate things. It was effects of early mobilization on post total hip replacement patients. So I would think that the intervention of early mobilization and the population of interest, which is post total hip replacement patients, it is quite difficult to implement. It is quite difficult to do a randomized controlled trial just because of sampling and the timeframes between post-surgery and early mobilization, which is kind of the day of operation or day one post-op. So that might have a difficulty with, or rather the researchers might have difficulty in sampling to conduct a RCT as compared to a cohort study where they could recruit participants before the intervention and then study them down the line.
I was just a bit puzzled about what was randomized. What were people randomized into then, I suppose, isn't it? And was that not an RCT originally? But maybe we're going into too much detail here, and Tuki needs to move on.
Yeah, no, it's an interesting one. But of course, as soon as you start to look at the kind of politics round about who gets involved, who doesn't, when it's surgical related, there's all that element about, well, who gets picked for the study, who doesn't get picked for the study, who gets the surgery, who doesn't get the surgery. We'd need to know a little bit more about the minutiae of that selection process to really make a judgment in that. But it sounds as if you've got enough to go on. It sounds as if you've got plenty to kind of critique and summarise. But remember, we're not trying to answer the question. We're really just trying to demonstrate that you've kept that clarity of process all the way through, from your reflection to the development of your PICO, to the PICO itself, to the search strategy that reflects your PICO in the search strategy with all the inclusion and exclusion criteria. And then when it comes to your findings through your PRISMA, how you've got to your 3 annotated bibliography, or those 3 papers that you've selected for your annotated bibliography. When you've structured that bibliography with your synthesis and your table of strengths and weaknesses, your findings should be on what you found. So it's based on the findings of those 3 papers and your summarization and your conclusion based on that. Now, it might be that there are other studies out there that are better, and that's just the way, when we've asked you to only come up with 3, that might be something that you do find that happens, but that doesn't mean that you're going to be marked wrongly. I would far rather that we demonstrated this flow of storyline from start all the way through to conclusion. Any more questions on that, or will I just open the floor up in general to anything, guys? This is your opportunity. You've got two of the team to ask any kind of live questions that might not already be there on the Padlet. So if you want to put your hand up for a question, great. If you want to post a question in the chat forum, as long as you're a quick typist, we'll be able to get to that. I'm hoping that silence means that we've explored so many of these concepts, not just over today, but over the last few weeks. And hopefully things are becoming a little bit clearer. Tim, you're getting the floor today.
Sorry,
this is a place for it, Tim. And do you know what? There's probably others in your group are having questions as well, but they don't, you know, and that's the nature. You might be asking a question that can go across half a dozen other students.
Yeah, I don't know if this was answered in the Padlet, but I couldn't find an answer to it. So just with regards to the recommendations for future practice portion of the essay, you mentioned that there was a point that we could answer regarding the methodological strengths or weaknesses for the 3 studies, and I would think that we would conduct a synthesis of the methodology across the 3 annotated bibliographies. So do we have to write about the same points in the previous section regarding the annotated bibliographies for the methods?
You pick out why your conclusion is coming with confidence, and if your conclusion is coming from confidence because of the level of rigor of the 3 studies you've selected, that's what you would be saying, because there appears to be these particular strengths of the research and that you've found. You could even just direct the reader to the appendix, because the appendix table is demonstrating all those elements, but you're picking out the elements that give you the feeling that this particular area of research is fairly well supported.
Right. So in the 3 annotated bibliographies, sorry, I didn't catch it.
So your annotated bibliographies are almost like individual little critiques on that paper. So that actually gives you a kind of bit more of a kind of deeper dive into that paper. When you do your quality appraisal synthesis in your table, that pulls that together and you stick it in the appendix. But you'll probably refer back to that appendix when it comes to your recommendations for future practice. And if you are going to be recommending future practice to shift or to change or to stay where it is, you probably want to make some very brief commentary as to the level of methodological rigor that's in the articles and the papers that you've actually found.
All right, so when we individually appraise each of the studies that we found, do we have to identify the points to critique that is the same across all 3, or are you looking for like a diverse?
It's more individual at that point in time, isn't it? At that point in time, when you do you've only got what, 300 words per annotated bibliography. Remember, you've got your citation, which counts for nothing, which is great. We're giving you words for free, and then of course you've got this description of the study. Then you've got your evaluation of the research methodology in that particular study, and you're identifying the main strengths, the main weaknesses that they may have therein. And that gives you an ability to critically evaluate the findings that particular paper actually had. So it's not necessarily pulling across all 3 studies in your individual 3. You're really just actually looking at that one particular piece, and then you pull it together. And so your recommendations for future practices, where the synthesis comes in, actually brings together all the questions that you've had round about your PICO, and it tries to kind of give a consolidated answer across the 3 papers. So
Okay,
keep your synthesis element for the recommendations for future practice. Okay, it is quite a difficult it is quite a difficult piece. There's different elements to this, and you've got your reflective element, you've got your justifying your proposal, you've got your search strategy and what you're going to be doing, and then of course you've got this pulling out each paper's strength and weakness and how that answers your PICO or how it doesn't answer your PICO based on the level of evidence that's actually there. But that last section, Tim, is really quite important about answering your question. It's about trying to say, okay, from our PICO, have we been able to answer and recommend any shift in practice or change in practice based on the levels of studies that we've actually come across? And that's where you have to kind of go back to the kind of synthesized measure of strength of the papers that are actually there. I think one of the other things to think about, and I remember that the guidance that we've given you in the assessment piece, that there's that list of bullet points, they're not to be done as an exhaustive list. I mean, they're really just prompts to try and allow you to actually answer recommendations. But what are the continual problems that you've got? Have you actually answered your question? Are there still areas of research that need to be done? What aspects of practice can still be used safely, remember, because this is another thing, we're not just trying to throw the baby out with the bathwater here. There might still be elements of care that they might not yet be totally understood, but they're not got any adverse harm or risk to the clients. They're maybe low in resource. As long as they're measured well and the outcome measures that are used in clinical practice are sensitive enough to demonstrate impact and change of an intervention, I think you're well within your rights to continue down that road and use that intervention in a way that at least does it in a kind of critical fashion. Okay, I don't know if there's any more questions on that. If there's anything that comes to mind, please pop your hand up. Just to remind you that module evaluation questionnaires are happening right now. You should have been invited through uni to complete the MEQ through GCL Learn. It is open until midnight, 23rd of April, which I know will still be within your placement period. But as for as many of you that can actually respond to the questions, certainly the questions that are related to the module teaching, this will allow Fred, myself and David to build on this for next year and maybe give us an understanding what we're doing well and what areas we need to provide clarity to. We appreciate it's been a difficult year from the practice placement aspect of this module because we couldn't get you all out at the same time. So in future deliveries of this, we hope to have all students out at the same time during the course of trimester B, so that whatever we are teaching reflects much more closely to the experiences that you're actually getting in practice, and we appreciate that's why it's disjointed this year. But the team know that, and that's why we're giving you extensions for your essays, and we absolutely will demonstrate that understanding when we're looking at the essays that are coming in. So if you can spare 5 to 10 minutes, please do it now. This is the important time to do it, because if you forget to do it now, you'll probably forget to do it again. So I'm giving you the big green light to go and do it as you sign off from today's session. And please, go and follow that up at your own leisure. Any future questions that you might have? There are, as Tim said, a plethora of questions and answers, and many of them duplicates. So please take the time to read through the Padlet to see if your question has been asked, see if the answer is there prior to you putting up the question again, because the module team have been at this for the last 5 or 6 weeks, and every time we go, it seems to have just grown in size again. So please take time just to kind of search over some of the Q&As that are there. Before you post your own. You might find out the answer before you need to write your question. Without further ado, if there's anything else or nothing else, I'll probably pull a close to this session just now. It's been great having you all over the last 12 weeks. I know it's been quite hairy with placements, but certainly Fred, myself and David have really enjoyed the formative stuff that you've been putting in on GCE Learn. This goes for all groups. And certainly it's helped us understand where you are as a cohort on this little journey of embedding research methods into practice, which is not an easy thing to do at the best of times. So thanks for your efforts all the way in the last 12 weeks. It's really helped. Okay, guys, we'll speak soon.